Welcome to the Let's Talk Health and Care podcast series brought to you by the Integrated Care Academy at UE Bristol. We'll be diving deep into exciting research and service changes by speaking to the people directly behind them. I'm Peter Brindle. I'm a GP with a real passion for service improvement, health tech and innovation.
And I'm Marc Griffiths, Pro Vice Chancellor and sponsor for the Integrated Care Academy at UE Bristol. Welcome to Let's Talk Health and Care.
Hello and welcome to a very special episode of Let's Talk Health and Care. If you've been with us from the beginning, thank you. You've joined us as our conversations have evolved and explored everything from robotic telepresence, 3D printed food, all the way through to tribal mapping in Weston-super-Mare. Over 10 episodes and with 15 really remarkable guests, we've uncovered some fascinating insights. But today, sadly for you, you're stuck with just the two of us. We wanted to pause, look back and explore some of the patterns and connections that we've discovered over the last few episodes. And so Marc, it's been quite a trip, hasn't it?
It has, Peter, and I can't quite believe it's been just over a year. And when we first discussed this, I remember each of us looking at each other thinking, crikey, what are we doing in terms of venturing into the world of podcasts, which I don't think either of us had any knowledge or experience of. But this, I think, obviously links back to the origins of the Integrated Care Academy, which, we reference in episode 1 from memory, I believe. Didn't really mention it that much in the subsequent episodes, but that's not a bad thing because I think what's happened is through the guests, the topics, and what we've explored, we've, I think, stayed true to the mission and the objectives of the Integrated Care Academy around trying to bring people, knowledge and innovation together. And then through the lens of the three kind of priorities of workforce development, technology, innovation, and social good and impact, I think we stay true. And I think the guests that we've brought in to speak with us and their powerful kind of journeys is testament to perhaps building it on a solid foundation about what the ICA was all about. So that's my immediate point. But what about you in terms of what's your kind of initial kind of reflections?
Well, we certainly did our best to stay true to those three priorities, and I think some of the episodes had more of some parts than others. So they didn't all major on workforce research and tech. Some were mainly tech and a bit of research, and some workforce. But largely, we stuck true to those three main priorities. I mean, I could reflect on this for hours, so I'm going to save our listeners that. I guess there were loads of things that I thought about. First of all, inspiration from our guests. Every single one of them I found as individuals really inspiring through their hard work, their ambition, their values, the personal stories that actually triggered most of the guests into doing the work that they presented with us. The technology. Well, in fact, why don't we start there?
Yeah.
We had a lot of tech, haven't we?
Yeah, well an awful lot of tech.
Anything stand out for you?
So much. And again, I remember, and I'm not going to apologise for this because I remember us also having a conversation. It's funny what you do remember. We were, I think, a little bit worried about making it too technocentric at times in terms of this podcast series or having too much technology. But for me, the intersection of technology with humans and people is so powerful. I think for me, some of the kind of real surprises and real innovation points have been things such as the classes that have been set up by Praveen Kumar, for example, which used a web-based approach to bring in people from diverse backgrounds after stroke to then help them with their rehabilitation. Quite low fidelity on the grand scheme of things, but the impact was massive within communities. The smart socks, I can never look at socks the same way again in terms of Zeke smart socks. I guess talking to Apple and Air about the prosthetics and the ambition for socially affordable prosthetics for people that could be 3D printed and his vision, I think. They're just some of the key elements for me. But I'm sure you've got other ones too, Peter. Come on.
Well, you mentioned 3D printing. I really loved 3D printing of food because first of all, I just couldn't get my head around it initially because I think of 3D printing of chunks of plastic and then Alex had a real knack of just explaining it so that I understood it. Making ink food, I think he talked about. And of course, I was pretty tempted to try and invest in a piece of kit for my own kitchen to make up for my lack of interest in cooking. And just the thought of having a machine that could just do it sounded great.
But just the ability to think about that within a lab, and then how that could be brought into the kind of mainstream environments for patients with dysphagia and other swallow conditions or post-stroke, and just, again, really powerful. And I think just the act of normalizing what is, to some people, quite off-putting in terms of science and technology, and then bringing that into the mainstream, I think, again, that's a real strength to, I think, what the ICA is trying to achieve. And through the guests, we've, I think, tried to bring that to life for our listeners and giving them a bit of airtime around where their expertise lies.
I could imagine in years to come, with sort of miniaturization of technology, having a food 3D printer in every care home for those residents that suffer from dysphagia, unable to eat regular food. It could really harm them, and it could be just made there on site without it having to be bussed in. So thinking how some of these technologies could progress, I found really interesting as well.
I think also there's something for me around how we've tried to shine a light on the not so obvious spaces, which I know we'll come to in this episode. But some of our academics, and we said in episode 1, didn't we, that the Integrated Care Academy is that intersection between almost the academic institute, its research, which is very applied at UWE Bristol, but there's also something around then connecting through with social policy, with tech companies. The episode with Matt Freeman, for example. That's unusual for universities. Well, unusual on a mass scale. But as we move towards this notion of becoming, I believe, a fourth generation university where innovation's at the heart of everything we do, and we're doing it with partners and for partners, but alive to government policy, alive to the sector norms and differences, and also with one eye on what's happening across the rest of the world, because you can't ignore that. I think there's a really powerful kind of message here about, what is the purpose of a modern civic-facing university. And I firmly believe the ICA epitomises that in trying to cut across different sectors and different levels.
And within healthcare element of that, again, we've had loads of episodes on this around how community-based healthcare is potentially the absolute key to unlocking the sort of forever mismatch between demand for healthcare services, but the resources to supply it. I mean, we had various episodes on that. Caafi Health, for example, organisation grown from the community, an organisation that understands the challenges faced by parts of its inner city community, as well as understanding the problems, also understanding the potential solutions to fixing it, as well as being an efficient supplier and provider of those services, while also creating jobs for people who perhaps otherwise wouldn't be finding work easily in those communities and those geographies. It's those kinds of organisations that I think are the way out of our real challenges that we have providing health and care.
Yeah, I completely agree with you, Peter. And I think that is the absolute tonic to what I just mentioned there about fourth generation university. Is this one becomes helpful and impactful if it's lived and felt by those populations in which it needs to be placed, and effective within diverse populations. And I think actually you mentioned kind of Caafi Healthcare, and obviously having Huda and Ilham in as guests really brought home for me the co-creation and co-production that's possible between an organisation which is still in a relative infancy, if we think about the grand scheme of things and how long it's been going for, but also working with colleagues at UWE and working with community members as well. And I know that you do a lot with Caafi Healthcare in your wider kind of portfolio as well. So it's just great to see that come alive within Bristol and the surrounding region.
And the whole our one and only, but not the last, on-location podcast recording at the For All Healthy Living Centre follows that same theme, where health and care isn't all about hospitals, isn't even about general practices. It all starts in communities, within families, and if that goes wrong, then that has knock-on effects that affects the whole of the rest of people's need for healthcare. They get more ill. They often find it hard to navigate healthcare journeys, so they end up in going to places that are not necessarily best for them. So the community is absolutely key.
Yeah.
I think that probably that may have been my overall the big message from our podcast, that outside universities, outside hospitals, that's where the real initiatives can be made. And the onus is on these large organisations, institutions, to build those bridges to empower communities to be the best they can be, that helps the communities and also reduces the need for healthcare. So that perhaps, if I had to choose one major message from all of these wonderful podcast episodes, that's perhaps the one for me.
Yeah, it's really powerful. And I like that, Peter. And it also feeds into, I think, then thinking about if you've got a connection point through to an educational environment, where beyond the health needs could there then be educational needs? And that might start with a foundation program. It could start with lifelong learning. And we know, don't we, that the most hardest to reach and underserved populations, we really need to be thinking about our approach in terms of how we connect through. We are doing some great work as a university, as most universities are, but it has to be felt by those communities and be really authentic in terms of what's happening. And a great way of doing this is through that kind of, as I mentioned, co-production, co-design in terms of services, education, and long-lasting relationships. And I guess that fits really well with the kind of locality partnership work that's currently happening across the kind of city and region, the real need to think about where resources are deposited for those kinds of services as well.
One of the other things that we did that I found most interesting and perhaps most challenging was that some of our episodes talked about stuff that sometimes just isn't easy to talk about, and in fact quite often just isn't talked about. We did confront some tough topics, didn't we?
We did,
Marc?
yeah, we did, yeah. Which ones for you? I can go first if you want me to, but which ones? Come on, let's try and share this one, Peter, because do you know what? Some of those episodes were tough. I'm not going to lie. They were tough in terms of...
Well, how did you feel before, for example, the one we did on child sex abuse? How did you feel about preparing for that?
Uncomfortable. I'll say uncomfortable because reading the kind of prompts that you always do before our podcast episodes just to make sure that we've got good alignment and flow with the guests and everything, I felt very uncomfortable. I also felt very sad and a sense of, how can this be in this day and age? But that's the problem, isn't it? It's sometimes if it's not in your face or it's not that overt in front of you through whatever medium, it can be not so hard pressing. But I think what Kieran McCartan did was he really brought to life the interconnection points for me. And it was really powerful having him as a guest because as the conversation went on, I became more comfortable with the conversation in a sense that the restorative justice elements, the whole approach to offending and what that means, I think Kieran was able to really, really explain that to us, the audience, in a very compassionate, which might sound unusual me saying that word, compassionate, sensitive, and trying to look at it from a much more social, organisational model. I found it tough, though. How about you?
Well, it was tough for various reasons. First of all, just the plain speaking that Kieran had. So clearly he's immersed in this subject. He's hugely recognised as being a world leader in this area. So it's kind of normal for him to talk about these things. Yeah. But for someone, probably for most of us, it's not entirely normal. No. But the way he talked about it in such a matter-of-fact way, I found it initially a little unsettling. But I'm so glad he did it like that, because soon we got on to actually the things that could make a difference. And overall, I was left with a feeling of optimism, really. Yeah. Because in my mind, sex abuse, sexual violence in general just feels a terrible thing and it just happens, and we lock people up. We try and look after the victims to a greater or lesser degree, but it's a sort of fact of life and there's nothing much that one can do about it. He was presenting for me an optimistic, future-looking view that actually we could prevent child sex abuse. And there are people around who are willing to work with people who had concerns about their potential behaviour and work with them to reduce it. And I was really pleased to hear that, because I imagine that anybody who was to raise a concern thinking that they're having some thoughts that they feel really unhappy about and they know that they're bad thoughts but have nothing they can do about it, I'd have thought people like that raising those would be just shunned by communities for understandable reasons and feared. But he gave hope because he gave some good examples of where people in communities have been trained to be receptive to talking to these people who've been brave enough to raise their concerns about themselves and work with them in a kind of a well-being and a mental health way, rather than saying simply you're a bad person, we're going to lock you up.
Yeah.
Or hound you out of your house so that you have to go to another village and all of that. So I actually was left with a feeling of optimism that there is a potential solution should we develop the political appetite for doing that.
Yeah, and I guess Kieran's international lens really spoke through as well in terms of what he's seen happen in other countries, the approaches that are taken, particularly in, I think, some parts of Europe, for example, where he's obviously well connected. And but it was uncomfortable, but I'm glad we did the episode because, again, I think it pushed us into a different space with the podcast series and also pushed, I think, the ICA into a much more social justice, restorative justice kind of space where perhaps it wasn't originally conceived to be in that space. So I think that linkage through is really, really helpful. Another, I think, angle as well was, for me, pretty uncomfortable was episode 2 was with Nor Nixon and with Anthony Hill around the kind of anti-racism and the inclusive training in practice episode. That was a hard listening back to it, but also, again, in the preparation. And if you remember, that was the first episode with guests. So we were off the blocks, Peter, weren't we? In terms of we didn't start with a gentle kind of and again, was that the best thing to do? I think it was actually, because I think it set the tone and set the kind of level of intent with the podcast series to really lean into some of these challenging areas, particularly racism and how it presents within healthcare, and particularly for our global majority students on those programs. And I have to say, only yesterday did I get the final report from Nor Nixon's work. A final report because that project's now come to an end in terms of what it was funded for. The richness of what's in that report is just going to be so helpful because the resources that have been created, the mentorship programs, the help and the calling out mechanisms for our students, particularly global majority, is in a much, much better place than what it was before Nor led this project.
They produced some amazing... So I was impressed with the products they produced. I was really impressed with the way they created those products. They found those fantastic experts who worked together and created wonderful tools. Even more important than that, though, because I've seen over the years plenty of brilliant tools being produced by people, but they sit on a shelf and they never get used. And the investment from the ICA and others enabled Noor and Anthony to work with other organisations in the Southwest to ensure that these tools are actually being mobilised and used to benefit our students and staff. Again, that's a sort of a theme, is research and toolkits and all of that, in a way, are kind of easy to make. They're kind of fun, exciting, clear beginning, middle, end. But what's truly difficult about most of these innovations, technological ones as well, is getting them used. Because no matter how good they are, getting people to change the way they work and the way they live to embrace a different technology or a different way of thinking in this context, racism and anti-racism, is the truly hard bit. It's the less sexy, but it's the bit that requires a lot of hard work.
Yeah, I agree.
And I think that Noor has done an amazing job.
Yeah.
Making a start with that, it's not a finished job, is it?
No. So when I say the final reports come in, I mean, the hard work really starts and has started in terms of the embedding, the commitment to embed and do this effectively across many organisations. I wonder, though, whether we should spend a few minutes just talking about the entrepreneurs and innovators that we've come across, all of which I would classify as being in that category. But there is, I think, something for me around really celebrating and recognising those that put, their savings, their hard work on the line to trying to create things. I mentioned Zeke's Magic Socks and stuff, but there was many other examples, wasn't there, Peter, of innovators that we came across as well.
And each of them I got a little story about why they were doing the thing that they were doing. Yep. I think Zeke was an engineer in defence.
That's right. Yeah, he was,
defence engineer. Yep. And then because of an experience with his great-grandmother, recognised there was a huge need for people with dementia. And he didn't just recognise there was a huge need, he then applied his skills and his time, his effort and his risk to actually doing something about it. How often have we sat around thinking, oh, well, there's a real need for this, kind of assuming that someone else is going to do it. So he actually did it. And Jenny from Ferrix, the probiotic company, I like that because she was a hardcore academic, or thought she was. She mixed with academics. She had got an academic career in her mind planned out. Yeah. But again, from her own experience, she discovered that certain products were just rubbish at helping flare-ups of irritable bowel syndrome. And she happened to be working on bacteria and things at the same time, and met somebody else who had the same interest. And then they basically put their whole academic career to one side and take a risk in running a business, and becomes, what did she call it, an unfunded side hustle for years. And then, whatever, 8 or 10 years later, it becomes Ferrix. And I really hope it grows and finds the market that it should. Yeah. So it's that risk-taking while following the passion that's being triggered by something personal.
Yeah, I agree with you. And other colleagues then, people spring to mind, colleagues like Nikki Cottrell and Bahara Vahabi, in terms of the app, the Continence app, that we discussed in that episode, and the whole, how that was helping people through a relatively low-cost piece of software via an app, be able to have the confidence to go out of their own homes. I mean, it wasn't until that episode that it really struck me about, if you have a bladder or bowel incontinence issue, the fear of leaving your home and what that does to your life in terms of, all kinds of dimensions. So they really respectfully talked about how something like that, and education and support for all populations, and then talking about the effects of ketamine, for example, on the damage to bladder walls. And, that was a beautiful example of coming together with the science and the health prevention dimensions. So for me, again, may not seem obvious, but in terms of that innovation spirit and those two colleagues and how they work together, really powerful, So those kind of double act, if you like, how they join up. So powerful in terms of coming together. So again, we come back to one of the jobs of the ICA is also, and you and I know this, Peter, is bringing people together. I think sometimes we come across as being matchmakers, don't we? Because I think we've now established a really good knack of bringing people together. Some things click, some things don't. Yeah. But in particular, those that you've spoken to over the last 12 months and beyond, just those initial seed conversations around where they're at, and sometimes people just need a little bit of confidence and a bit of a kind of wisdoms from those that have maybe either trod the path or know how hard the path is. And we do know, don't we, that getting anything to land and stick in the kind of health world as a product is pretty difficult. It's pretty hard. So I think, again, if we can do things to actually bring people together in that entrepreneurial innovation kind of space and do it faithfully, I think it's a great place to be.
Oh, for sure. And thinking of the bowel and bladder episode, again, two things that people generally don't talk about.
Not really.
They're not the kind of cool bits of the body. They're not the heart or the brain.
No.
Your bowels and your bladders. But they're pretty important pieces of kit, and when they don't work, it really does affect your lives. And I remember, I think she said that people often wait 10 years from when they first get symptoms of incontinence to actually seeking help. And that's 10 years of unnecessary misery, and how using this Confidence app can help people understand their condition, know when it's appropriate to go and get advice, and also do things themselves. That's about empowering people to do things for themselves and not be either a victim of their own fear or shame, or dependent upon healthcare professionals, at least from the beginning. So, yeah, really like that. I was also struck by Apollinaire. Again, the story that got him into this. And he's such an inspirational guy. I could listen to him all day. He wants to create the easy jet of prosthetics because at the moment it's so darn expensive for people to have the latest technology in prosthetics in their joints and limbs. He wants to make that easily available for everybody, which I think is a fabulous ambition. And I love the way that he was almost challenged into doing the work, because he met, I think it was Andy Lewis, who's the 2016 Rio Paralympian triathlete guy in a swimming pool, who basically said to him, this is all great what you're doing, creating joints for robots, but hey, what about people? and that was like the turning point for Apo, because he thought, actually, why don't I do some work with people? And they set each other these little challenges, and off they go. Yeah. And I love that story.
But it's interesting because his whole Apollinaire, who's just a fantastic innovator, a fantastic, caring, compassionate colleague, he's working really hard with places like the Bristol Centre for Enablement in Patchway. He's working internationally with colleagues, trying to really think about always reducing the cost of materials and the cost to provide something so it can be dispersed and dispatched to as many countries as possible where there frankly isn't a lot of money, there frankly isn't a lot of resources, and make them so low maintenance, these prosthetics, that actually it really enables people to live as normal a life as they can. And I think there's something that goes deep, deep beyond the mechatronics dimension. This is about who you are as an individual. And, the same can be true for all the kind of guests we've had on, Peter, in terms of their core drive, what's driven them to this social purpose of not just innovation, but social innovation as well, which I think is a really kind of key flag for me, I think, in all these episodes.
You just have to turn on the TV and you see wars everywhere.
Yeah.
The amount of people that must be being created every day who have lost a limb of some sort, but would feel that not in a million years would they be able to get access to a decent prosthetic beyond the basics.
Yeah.
And if we're able to translate, if Apollinaire was able to translate his technology along the lines that he wants it to be, then that could change the lives of countless millions of people around the world. So this goes beyond Bristol, beyond England. This is potentially a world-leading innovation that could change people's lives. So
completely, and I hope for him he doesn't just realise that dream, but I hope we can play some part in kind of helping to support that as part of a wider ecosystem to do just that, and working with colleagues in the NHS, private industry, funders there as well. There's a real, I think, opportunity here as well. One story, though, that I think we should come back to is probably the episode at the For All Healthy Living Centre, because we were, we'll bring Rog in just a short while, but without the technical expertise of Rog and to give us the confidence to do this on-site recording away from the studio was a gamble, and I'd never done anything like that before. And I think so glad we did, because just listening back to that episode and listening to all the sounds, how you in particular, Peter, described the environments and that rich conversation from Joanne and Marc, it just added a different perspective for me in terms of what these podcast episodes are all about. I don't know about you, but I was really struck by that one.
Oh, I really loved our little field trip to Weston. I think we recorded the first bit of the episode. We were just sitting in the cafe, surrounded by loads of regular people getting on with their day. And I got a real sense of this fantastic building in the heart of a community being really useful for the community. Yeah. It was full of people doing stuff. And of course, the thing that we were particularly talking about was how a number of people end up going to emergency departments in hospitals more often than perhaps they need to or should do, because of bad things that have happened to them in their life, or because they find it hard to navigate a complicated healthcare system. And that's what the episode was really all about. And I just got a sense of this welcoming building where you could, if you lived in that area, where you could go and you would find other people who are either sharing your experience or other people that may be able to help you and guide you if you're going through a difficult patch. And there was one lady who I met who I think she said was, you can just small amounts of money and time can make a huge difference. I think she mentioned something about if a family can't have a washing machine, they can't afford a washing machine, so their kids don't have clean clothes, that already puts them at risk of their kids perhaps needing some care intervention and then a path through social care. Facilitating them to have access to a washing machine or a refrigerator so that they can provide food can stop a whole escalation of social events leading to then health events, leading to potential ill health. And I was really struck by the power of that.
Yeah, I agree with you. And for me, again, the dimension of being out in practice, and I always remember Marc's opening sort of words of welcome. And I say welcome because you've come to us as opposed to us coming to you. And that's always stuck in my head, actually. I must have listened to that episode probably 3-4 times now. And that struck me. The other things that struck me was around when Joanne mentioned that the hospital was just a small little dot on Marc's whiteboards, which I was a bit obsessed by, let's be honest, in terms of those whiteboards.
We even ended up with a photograph of it, I think, at the end.
We did. But she was right, wasn't she, around the realisation for her in terms of coming out of the hospital environment, where Jo was really honest and spoke about her own kind of, journey, and that's where she's based, most of her professional life. Suddenly making that big step to come out and meet up with Marc and understand what community-based interventions and what a hub like this was all about for the community was really powerful. And just Marc's knowledge about just nomadic working, the whole kind of tribal mapping, the whole kind of interconnecting points between social interventions, local authorities, when funding dries up, when families are literally on a real tightrope in terms of, challenging things happening to them because they haven't got the basics in place. A place like this becomes the beating heart and becomes such an important part of the community. And you could feel that, couldn't you? You could feel it. Right from the person behind the counter serving the coffee who was glad to have a job, right through to the sale of clothes and books, right through to the toddler and creche kind of environment, right through to the broader library element, right through to the cafe area where you had people coming in. It felt so inclusive and just so powerful for me.
That tiny spot on the map, the hospital being a tiny spot on the map, was a good cause for reflection, I think, for those of us who are kind of grown up, spend our entire professional lives working in professional healthcare. And those who work in hospitals can often, not surprisingly, feel that is healthcare.
Yeah.
And then it made me think, I'm a GP, so of course I see it all in the community. But actually, I thought about afterwards, quite often think that maybe general practice, is where it's all at. 95% of NHS consultations take place in general practice. So maybe that's where it's at. What I learned from this, of course, which I probably knew, I guess, but it brought home to me that a GP surgery is a tiny part of people's lives as well. And it's their social networks, their family, and other voluntary community resources, charities. All of that makes up a vastly more important element of people's ingredients to them either being healthy or unhealthy than these kind of statutory bodies that we see politicians talking about all the time, that are proper buildings that people can have photographs next to. So it's really about all the sort of kind of upstream prevention within the community, which we mentioned right at the very beginning, didn't we?
Yeah, we did. And again, I got a couple of quotes here that I haven't remembered these quotes. I can't remember all the quotes, Peter, but Huda talks about in the episode with and Ilham about trust lives in communities, not institutions.
Yeah.
Nikki Cottrell talking about pharmacies, libraries, hubs, meet people where they are. These are really powerful quotes and really powerful statements around how you really build a locality model that is faithful, empowers, and respects, I think, the communities within those kind of areas and who lives in those places. And I think the 10-year plan, NHS plan, goes some way to start indicating this, but a lot more work's needed in terms of how the workforce is transformed, the model of care and flow of resources. And you're right, it's not all about having pictures taken outside shiny buildings, because actually it doesn't need shiny buildings. What it needs is places that care and care absolutely about the people who are in those environments.
The prevention side and early intervention before people get sick kind of feels blindingly obvious. We've grown up with the saying that prevention is better than cure. We all know this, don't we? We all know this. Everybody knows this. But why is it so hard to deliver? The workforce that we have in hospitals has grown hugely in the last 20 years, far outpaced workforce outside hospitals. Resources generally at the top end of healthcare, the stuff that takes place in the buildings, the general practices, the hospitals and the like, huge investments, partly because they're there because they can't say no to people that walk in their doors who are ill. They need the staff, they need the buildings in order to service the needs of people who are genuinely ill today. But that sucks in resource away from all the preventative efforts that could potentially stop a good proportion of people getting prematurely ill and therefore needing resources. So it's a real bind, isn't it? And I think part of the problem is when money gets short, investments in preventive services are always the first to be cut. Because if you do a decent preventive service, the best result you're going to have is that nothing happens. No one gets ill.
But that's a result in itself, right?
That's a brilliant result, but really hard to document.
Absolutely.
No great photo opportunities.
No.
Nothing has happened. Great. And also, it's probably nothing has happened in 5 years' time or 10 years' time rather than tomorrow or the day after. So it does make for difficult investment choices for those who allocate resources to try and both meet the needs of today while also preventing the future. But I think the 10-year plan and the vision around community-based neighbourhoods, neighbourhood health, perhaps strengthening, empowering hospital trusts to have responsibilities beyond the people that just come through their doors, but also some resource, ability to share resource to prevent people from coming through their doors. I feel quite hopeful about that.
Yeah, likewise.
In my view, I think that's the way forward. Because if the money's all divided up into those who treat ill people and those who prevent it, inevitably all the money will stay with those who have having to deal with it. But if they're given incentives and some kind of accountability to prevent illness as well, they can then make it a little easier for them to shift those resources to do that. So I'm feeling a little bit hopeful.
Fantastic. I feel optimistic as well. And I think as long as there's a respectful inclusion and co-creation, I think these sorts of things can happen. As you say, Peter, it's about being respectful to different types of communities and where care is needed the most. And also recognising that not everyone's got the same level playing field of infrastructure, resources within those spaces as well. And that can come down to things like transport, buses, so it's a bigger kind of context of the social infrastructure that goes around your care pathways that you might need as well. But absolutely. I do wonder if before we get into the final reflections, whether we would love to ask Rog, our sound and technical engineer, that's what I'm going to call
the man that makes it all happen, that cuts out loads of our babble. Yeah.
But Rog, we would love to just, as someone who's come with us on this journey over the last 12, 13 months, been with us since day one and kindly given your services on top of your day job as well, right, here at UE Bristol. And I know that you love the podcast Dimensions, but we would love to hear a few thoughts from you in terms of what have you learned from this, working with us and this podcast series.
And Rog, it's dawned on me that you have listened to these episodes
over and over
with far greater attention and detail than anybody else in the world. So if anyone's going to give us a few reflections of validity, you're the guy to do it.
Well, I've been really lucky at UE to record podcasts around lots of areas of work and tell the stories in sound, really. And with Let's Talk Health and Care, it's just been fascinating and a real privilege. What struck me really is the breadth of the work across the ICA, not just at UE, but all the partner organisations that we work with. I've really enjoyed the discussions around the research and the innovations that's led to. And the main thing really for me was how that positively impacts the groups and the communities in the region. People. It's all about people.
Mm-hmm.
Earlier in my career, I worked with community organisations across the country, so I saw for myself how critical health and well-being is in local areas. And working on these podcasts, I've been so impressed by the collaborations with all the organisations that work within the ICA who tackle health inequalities, they promote inclusion and they build partnerships. Also, the obvious expertise of the guests with the care and pride that they put in and the positive impact it brings. It's just been inspiring. So thanks for letting me do it. But don't ask me to name a favourite.
We won't, but we will ask you, are you on to doing a few more?
Let's do some more.
Good. Well, that's what we're going to be doing. I think it's probably time for us to wrap up now, isn't it? Marc, what's your final reflection on our 10 episodes we've had with our 15 guests. Final reflections.
I think for me, it's been what started off as, again, I go back to the Integrated Care Academy was conceived during and just after COVID. And something about the intersection between trying to innovate whilst also deal with the business as usual and the everyday, and how would you keep innovating in a very busy and sometimes chaotic world, and in particular in relation to healthcare and education. My reflections would be I think we've really tried to instill a sense of storytelling and also bring in those people with the stories to tell and those experts into a room to talk about their ideas, talk about their lived experiences, and really promote the intersection of what the ICA stands for. I think it's also evolved us as a university, actually. It's informed some other agendas that we're now starting to develop. I've also been, I think, really reflective in terms of just what a vast world it is out there, in terms of full of brilliant people who are doing amazing things. And I think it's important that we keep going, Peter, in terms of telling these stories. I think it's really, really important. So there's many other takeaways, but I'm just incredibly grateful for how we've approached this, I think, and how we've managed to bring the best out of our guests in each of the episodes.
Couldn't agree more. I think my main reflection is I want to do 10 more.
Yes.
There are so many more great stories out there, led by great people doing amazing things. And if we do anything, we at least shine a little bit of a spotlight on these brilliant people who deserve credit. They deserve acknowledgement. And I'm looking forward to discovering 10 more.
Absolutely.
Where are we heading to next then?
Well, actually, now that we've got a bit of bravery and experience under our belt from our last episode that we recorded, we're going to be heading out to the Empire Fighting Chance Gym, which is in the city centre. This is an amazing organisation that really gives opportunity for disadvantaged young people. It's an environment that's been going for a number of years now, and the co-founder and the CEO is a gentleman called Martin Bisp, and we will be interviewing him and just exploring the space, getting to have some mini snippets with some people who are in there, some of the co-workers, and even some of the people who are actually using the spaces. And it's a really, really important part of the community. And this is about reducing serious violence and knife crime, but also restorative social interventions for young people. So I think it's going to be an absolutely brilliant episode.
I'm looking forward to it. So we'll be taking all our kit down there.
I believe
with
so.
Rog and doing an on location.
Yeah, and I think Martin might even ask us to do a couple of rounds in the boxing.
Well, you and me sparring.
Yeah, why not?
As in physical sparring,
absolutely,
rather than just verbal sparring.
I look forward to it. I really do. I think it'll be amazing.
Yeah, it sounds like a pretty inspirational place that will fit our long line of inspirational guests that we've been having so far.
Yeah.
So it's time to thank our listeners who have bravely listened to a few of our episodes over the last year, and thank them for doing so. It's been, without the listeners, there's no point in doing this. And we'd be really interested in getting some feedback really from people. What did they enjoy about these episodes? Was there a particular favourite? Would they like a particular person or technology featured in further episodes? So do let us know, because we'd love to hear it, and we can try and do our best to facilitate it.
Absolutely. And we've got listeners from all over the world now, and I can say that genuinely because you can see some of the kind of the stats attached to the actual platforms. We're now on YouTube as well, so that's been a recent addition, but it's great to hear that we've got and see that we've got listeners all over the world, because regardless of what a healthcare system you've got in your country, this is something about bringing people together for the common purpose. So thank you for all our international listeners as well as domestic as well.
That's great. So until the next episode, it's goodbye from me, Peter Brindle.
Goodbye from me, Marc Griffiths.
Stay healthy
and take care.